Good morning. My name is Dr. Nahid Abbasi, and I am a medical laser and cosmetic dermatologist at the Summit Medical Group. Today, with the assistance of my volunteer patient, Caitlin, I will be demonstrating laser hair removal of the axilla or underarm. Caitlin has kindly agreed to allow me to treat her, and we will be demonstrating treatment on one side, that is her left underarm. So Caitlin is aware that laser hair removal is a safe and effective treatment for the permanent reduction of hair quantity. Typically, anywhere from 4 to 8 treatments are spaced approximately 4 to 6 weeks apart. And our instructions to patients are simply that they avoid getting a suntan to the area that we will be treating, because suntan or pigment in that area can result in discoloration from the treatment itself. We also ask our patients not to pluck or wax approximately 5 days to a week before treatment, because removal of the hair with the hair shaft affects the ability of the laser to effectively remove the hair. In contrast, if the patient were to shave or to use a depilatory cream, that would not interfere with the success of the treatment, and so we tell our patients that they can shave their underarm even the same day. So Caitlin, I appreciate that you're here, and may I just take a look at your underarm, please? Yeah. Do you mind raising it, putting it behind your head? Wonderful. So it appears that you have shaved recently, but just as per my instructions, you've left a little length for me, which I appreciate. And with your permission, what I'd like to do first is to go ahead and clean your underarm with some alcohol.
Okay. And
then pat it dry with a 4x4 gauze. After that, I'm going to put some protective goggles on you and me, and we'll go ahead and begin our treatment. But let me first remind you of what you're going to be expecting today. The sensation is like that of a rubber band snapping against your skin, okay, followed by a sensation of warmth. It is typically not very painful. Patients describe it as uncomfortable and more like a pinch than true pain. And most people don't require a numbing cream, which is why we haven't applied any numbing cream for you. With your permission, I'm going to begin by cleaning the skin with some alcohol.
Okay.
And after that, I'm just going to pat it dry with a 4x4 gauze pad. And now, let me ask you to close your eyes for a moment, because we'll be putting protective metal goggles on your eyes. Close your eyes, please. And go ahead and rest your head back. Does that feel tight, or is that comfortable?
Oh, that's comfortable.
Good. I'm going to be putting my own goggles on now. And I'm going to be putting the laser into ready mode, which means that you're going to be hearing some noise from the machine. Please don't be alarmed by that. I will forewarn you before doing anything, okay?
Okay.
Great, so the laser has calibrated, and now I'm going to go ahead and fire a pulse onto the floor just to make sure that it's working properly. 2, 3. Perfect. And now, Caitlin, if you are ready, I'm going to go ahead and hold your skin and begin treatment. So here we go. 1, 2, and 3. How's that?
Not bad.
Good. Excellent. Let me fire 2 more, just to sort of prepare you for what this will be like. And what do you think so far? Great.
Not bad.
Good. So now I'm going to go ahead and treat a broader zone more quickly. Okay, here we go. 1, 2, and 3. And I'm about to give you a break. So Caitlin, we are now approximately, I'd say, 1/3 of the way through on this side. And beyond the sensation of warmth, are you feeling pretty comfortable?
Yeah. Excellent.
Great. I'm just going to go ahead and distend your skin again, and I'm going to resume right here. Here we go. 1, 2, and 3. Excellent. Looking very well. Perfect. And now I'm just going to ask you to pause for a moment, as I'm going to look carefully at any hairs that may have been missed, and I see a few, and I'm going to go back and get them. Okay. 1, 2, 3. 2, 3. 1, 2, 3. 1, 2, and 3. Okay. Beautiful. Now, Caitlin, one thing that I want you to be prepared for, since this is your first time doing this, is that after the treatment, there may be, when you look at your underarm, the look of little black dots over where the hair follicles are. Those are actually hairs that have been singed by the laser itself.
Okay.
So it's sort of like the char on a barbecue after you treat. I know that's a sort of a funny analogy, but it's actually a good analogy.
Okay.
And what that means is that when the hairs grow out, they actually have been damaged enough by the laser that they may actually just fall as opposed to growing as proper hairs. Many hairs will not grow back at all, and some hairs that happen to not be cycling at this time may not be treated at all by this treatment. And that is why we tell our patients that it is not uncommon to treat 4 to as many as 8 times, spaced by approximately 4 to 6 weeks.
Okay.
So now, just looking one more time, because I think there's just 2 more spots that we were going to get here. 1, 2, and 3. 1, 2, and 3. Excellent. And 1 down here, 1 out here. 1, 2, 3. Perfect. So wonderful. So you have what is the typical amount of redness post-treatment. Let me just put the laser on standby for a moment. And before we treat your other side, I'm just going to take a look at how your skin is reacting to the laser. What I'm seeing, which is very typical, is some background redness in your skin and some swelling around your hair follicles. And that is called perifollicular edema. And that is exactly the response that we are looking to get. To me, this tells me that the treatment has been done properly, and I see that we've treated over the entire surface area. And that concludes our treatment. How do you feel?
Good. It wasn't painful at all.
Good. I'm glad. And some people say exactly that, while others report that it's more like a snap, but not truly a very painful procedure. So excellent. That is very typical. So let me go ahead and take your goggles off. Keep your eyes closed. And I'll put those down. And I will be removing mine as well. The laser is in standby, so it is very safe for me to do this. And that will conclude our treatment today. Laser hair removal is one of multiple laser procedures that we perform here at the Summit Medical Group. We also treat unwanted redness, including that of rosacea, using the pulse dye laser. We use fractional resurfacing lasers to treat fine lines, wrinkles, and skin texture, Q-switch lasers to remove tattoos, and other lasers to treat unwanted brown spots or sun damage causing brown spots. Anyone who is interested in further information is welcome to contact our department. Thank you.